I am actually very much in favor of healthcare reform, but in the private sector. It has to be patient-centered, private sector solutions. Being in healthcare, myself as a nurse and my husband as a general surgeon, we've been aware for years and years that there are many needed reforms that need to be put in place. We've got to bring down the cost of healthcare. We've got to make healthcare insurance more affordable. I believe that healthcare insurance for individuals and families is a personal responsibility. Unfortunately, over the years, we have slid into a mentality of whose responsibility is it. There are many out there that do feel that insurance should be provided for everyone. I would love for everyone to be on insurance. The problem is that somebody's got to pay for it. When you say, gee, I shouldn't have to pay for mine, but my neighbor should have to pay for me, that becomes the issue. And again, it is a personal responsibility. And I believe that we can make that clear. I think, again, if we can bring down the costs. See, right now, healthcare insurance, healthcare is so expensive that many people really do feel that it's just outside of their scope. So these are the issues that we have to deal with. If we can bring down the cost, then people will feel more able and capable of purchasing.
How do you encourage people in the short term to participate, to make things more equal?
That's one of the issues. Basically,
if there's not an individual mandate, how do you?
Sure. Well, the thing is if there's an individual mandate, you're forcing people to have to buy something. Just like, if you were to say, well, everyone has to buy a car. Or any other product. Even our president, when he was running for office, stood in front of a camera and stated that the individual mandate that you can't force someone to purchase it, and of course that ended up changing. But the fact of the matter is that how do you force people, especially people who are young and healthy? Young and healthy people don't think that anything's going to go wrong. But if the cost is minimal because they're young and healthy, if it's just another cost that they incur, then it's a much more reasonable approach for them to take and say, hey, yeah, I do understand that I need to cover myself.
What is your strategy moving forward? There's been some criticism that Republicans don't have a unified alternative.
That is completely untrue. That is the rhetoric. We've got to get the Obamacare plan out of the way. We've already voted to repeal. We're working on the 1099 provision. There's plenty of other aspects of the health care bill that fall apart when one piece of the puzzle is taken out. So, this is what we're doing. We're moving forward on this. Whether or not the Democrats and the Senate or the president are coming along, I don't know. I think the American people are going to be the ones who mandate that, because I think the American people are going to get tired of the reluctance on the other side in dealing with this. Overwhelmingly, the American people want this health care situation addressed. They want it addressed in the free market. They want it addressed where they can make their decisions for their own families and not have the president and the government make them for them.
How do you see newly elected Tea Party members shaping the health care agenda?
I think you've already seen it. I think the fact that November 2nd happened, we all ran on repealing Obamacare. I think the American people spoke then. I think we will continue to have a strong voice, and I think you're already seeing that. We're not standing down. We're going to keep at this, and we're going to fix this problem. We're going to fix it with the American people in the private sector, so that we can continue the great healthcare system that we've had in this country.